women are working now, they're having children later, what should they know about fertility and when should they probably consider IVF?
Well, it again starts right from the beginning. There are certain infertility disorders that get built up in childhood. And one of the commonest things is anovulation or inability to ovulate because of lifestyle conditions. The commonest such endocrine disorder which can lead to infertility is PCOS. And as we know, PCOS to a very high degree can be prevented by encouraging a good lifestyle, exercise, not sitting in front of the computer, not seeing the blue screen all the time, being disengaged from the phone, meeting friends socially, not on the internet, meeting them physically, doing physical exercises, trying to avoid eating things with a high glycemic index. Now, these are such simple things and simple values that can be given to children, which can prevent the burden of infertility later on. That's one. The other thing that we want to really emphasize on in our country is the burden of tuberculosis. Now we know that tuberculosis, the incidence and the prevalence is very high in our country, and sometimes genital TB may not even be thought about by a couple. But this can be one of the major reasons for tubal blockage and infertility.
Well, you know, Dr. Parikh, during this particular age group, 20 to 40, there are certain other medical conditions which one needs to consider as well. So, for example, what is the risk of health conditions such as chronic conditions within this age group? How susceptible are women during this age group? And what are the tests and vaccines you would recommend?
One of the commonest reasons for infertility today is wasting time and not considering that the biological clock stops ticking, slows down by 35, 36 and stops ticking by 40. Many women who are in their 20s and 30s feel that they can reproduce at any time. And once they've conceived, they feel that it's going to be very easy later on. So one piece of advice would be that look at yourself, look at your biological clock. As you're paying attention to your social commitments and your work commitments, please make a commitment to yourself to have rejuvenated yourself and being active in looking at your biological clock.
Make informed decisions with comprehensive analysis on the go.
Strengthen your portfolio with real-time market updates on the go. Create effective strategies with insightful expert opinions on the go.
Grow on the go with CNBC-TV18, now streaming live 24/7 on YouTube.